All right, let's jump right into a classic endocrinology topic that's an absolute must-know for exams: Cushing syndrome. If you've ever found the whole hormonal pathway thing a bit of a maze, don't worry. We are going to clear all of that up right now. Let's do this.
We're basing this whole breakdown on the fantastic summary notes from Dear Cat Premium Revisions. Their structured approach is just perfect for making this topic click, giving you the clearest path to really truly understanding this condition. So here's our game plan. We're going to break this down into 5 key parts. We'll start with what Cushing's actually is, then we'll play detective and hunt down the root causes. After that, we'll learn how to spot the signs, walk through the diagnosis, and finally, wrap up with how it's treated and what you absolutely have to lock in for your exams.
Okay, section one. Let's kick things off with the most fundamental question. What in the world is Cushing syndrome?
So here it is, the core definition. At its heart, it's all about one thing: having way too much cortisol in your body for a long time. And you got to notice that key phrase, from any cause. That's the huge umbrella that defines the syndrome.
Now listen up, because this is a classic exam trap. It is so important to remember that Cushing syndrome is not the same as Cushing's disease. Think of it like this. The syndrome is the big overarching problem: too much cortisol. The disease is just one very specific cause of that problem: a pituitary tumor that's pumping out too much ACTH. Getting that difference straight is a guaranteed point.
So that leads us perfectly into our next section. We know the problem is too much cortisol, but the big question is why? Where is it all coming from? Let's follow the hormonal trail and find the source. When the problem is coming from inside the body, what we call an endogenous cause, we can split it into 2 main camps. It's either dependent on a hormone called ACTH, or it's completely independent of it. This simple split is honestly the key to figuring out where the problem is starting. But hold on. Before we even dive into what the body's doing wrong, we have to talk about the number one cause of Cushing syndrome. And it's not even close. It's exogenous, meaning it's coming from the outside. We're talking about medications. Long-term use of steroids like prednisolone is by a massive margin the main culprit. Okay, now let's look at those ACTH-dependent causes. This is where the body itself is making too much ACTH, which is basically screaming at the adrenal glands to pump out more and more cortisol. This can be Cushing's disease, that pituitary tumor we just talked about, or it can be what's called ectopic secretion, where some rogue tumor somewhere else, often in the lung, has decided to start making its own ACTH. Now for the other side of the coin: ACTH-independent causes. In this scenario, the pituitary gland is behaving just fine, but the adrenal glands themselves have gone rogue. They're just churning out cortisol all on their own, completely ignoring any signals from the brain. This is almost always caused by a tumor sitting right there on the adrenal gland itself. All right, we've covered the causes. But what does a patient with Cushing's actually look like? Let's dive into the classic clinical signs, the ones that should make a little light bulb go off in your head that says Cushing's during an exam. These are the absolute textbook giveaways. That excess cortisol causes fat to move around and settle in very specific places. This leads to that classic rounded moon face, a fat pad on the upper back called a buffalo hump, and obesity that's really centered on their torso. And on top of that, the skin gets thin, which causes those very distinct, deep purple stretch marks, or striae, and makes the person bruise like crazy. But the effects go way beyond just physical appearance. This cortisol overload just wreaks havoc on the entire body. It can cause high blood pressure and even diabetes. It breaks down muscle, leading to weakness. It can seriously affect mood, cause depression, mess up menstrual cycles, and in kids, it can actually stunt their growth. Okay, so you have a clinical suspicion. The signs are all there. How do you actually prove it? Let's walk through the diagnostic pathway and see the logical steps you need to take. The best way to think about this is a simple 2-step process. Step 1 is just to confirm, is there actually too much cortisol? We use screening tests for that. Once you've proven that, you move on to step 2, find the source. You have to figure out why, and that's when you bring in the blood tests and the imaging scans. And this slide right here is pure exam gold. It shows you exactly how we can tell the different internal causes apart. Just look at the patterns. If it's an adrenal tumor, ACTH will be low because the brain is desperately trying to shut the system down. But if it's Cushing's disease or an ectopic source, ACTH is going to be high. So how do you tell those two apart? Well, that's where the high-dose dexamethasone test comes in. A pituitary tumor will usually listen to that strong signal and suppress cortisol production. But a rogue ectopic tumor, it just won't respond at all. Okay, we've diagnosed it, we've found the source, so let's get to our final and most practical section. How do we treat it, and what are the absolute key takeaways you need to walk away with? The management approach follows a really clear logic. First and foremost, you have to treat the underlying cause. If it's from medication, you have to carefully, gradually withdraw the steroids. If it's a tumor, the goal is surgery to get it out. While that's going on, you can also use medical therapy to block cortisol production. And this is critical, you have to provide supportive care for all the complications, like managing the high blood pressure and diabetes. And here is another absolute classic for exams. Examiners love to contrast Cushing's with its polar opposite, Addison's disease, which is a state of cortisol deficiency. And as you can see, they are perfect mirror images of each other. High cortisol versus low, high blood pressure versus low, weight gain versus weight loss. Knowing this table cold is such an easy way to snag points. So let's boil this entire topic down to 3 essential can't forget tips. Number 1, if you see that classic trio of a moon face, purple striae, and high blood pressure, your brain should immediately scream Cushing's. Number 2, in that situation, your very first question, before you do anything else, should always be about steroid use. And number 3, never, ever, ever confuse the broad syndrome with a specific disease. And that brings us to a final thought to leave you with. Imagine you walk into an exam station and you see a patient with all the classic signs we've just covered. Before you even think about ordering a single test, what is the single most important question you need to ask them? If you can answer that confidently, then you have absolutely mastered the most critical part of this topic.